In this video, we're going to discuss sedation monitoring. Proper monitoring is essential to ensure your safety during your sedation experience. I will outline some of the necessary forms of sedation monitoring. Really starts with an adequate and complete medical history. Conditions such as past heart attacks, strokes, high blood pressure, chronic obstructive pulmonary disease, asthma, diabetes, obstructive sleep apnea, they're absolutely essential to know. The American Association of Anesthesiologists, they've classified or have different classifications or grades of health. An ASA-1 is essentially a healthy person. An ASA-2 is someone with a mild systemic condition. An example would be someone with well-controlled hypertension. An ASA-3 patient is someone with a moderate to severe systemic problem that doesn't pose a constant threat to their life. They're well functioning if their problems are under control. An example might be an individual with high blood pressure, diabetes, and asthma, but they have things pretty well under control. There are more advanced classifications, but they're not allowed to be treated in an ambulatory facility. Anyone who's classified as an ASA-3 must have a clearance with their physician for treatment. We also routinely take baseline vitals. We take blood pressures, pulse, tissue oxygenation readings, BMI or weight classifications, airway evaluations to name the basics. If someone has uncontrolled high blood pressure, they need to get it under control first. A high BMI or weight may be a contraindication to treatment. COPD or chronic obstructive pulmonary disease may also be a contraindication to treatment. In other words, probably the most important aspect of sedation is obtaining an accurate and comprehensive medical history, including baseline vitals, with an appropriate consultation with a physician when indicated. Before starting the sedation procedure, all vitals are again taken with an assessment of the individual. If performed properly with good monitoring, sedation can be a very successful and safe procedure. We have various means of monitoring patients. Blood pressure readings and pulse are recorded automatically every 5 minutes. Tissue oxygenation is recorded continuously. This is a reading of how well your tissues are perfused with oxygen. Perhaps one of the most important aspects of monitoring is a patient's breathing or ventilation. There obviously has to be a patent airway for oxygen to get to the lungs so that it can then perfuse to the tissues. Our pulse oximeter, which measures the SpO2 or oxygenation of tissues, is important, but it doesn't tell us everything. It's old news. If a person is receiving additional oxygen, which they generally are, there may be a 5-minute or more delay from the time a person stops breathing before it's actually seen on the pulse oximeter. It obviously becomes of paramount importance to know if a patient is breathing. If a person is in a state of mild to moderate sedation, they are cognitively aware and awake. Remember the levels of sedation. They are conscious and have their reflexes intact. We know they're breathing. If a person may doze off just from being relaxed, not from too much sedation, or if they slip into a state of deep sedation or general anesthesia, or if for any reason they stop breathing, we want to know that immediately. Typically, this would result from an obstructed airway, from relaxed pharyngeal or throat muscles. It can be treated as long as it's properly recognized. Obviously, if a person is conscious and mentating, that's recognizable. Visible signs of chest rising and falling are obvious. The deeper a patient is sedated, the more crucial monitoring becomes. Remember, the pulse oximeter is old news. Perhaps one of my favorite monitoring techniques is the use of capnography. Capnography actually shows you on a screen the patient's actual breathing and measures the amount and level of carbon dioxide exhaled. This is the true measure of ventilation or breathing. It actually shows you in a wave form the quality of breathing as well as the actual amount of CO2 that's expired. It also measures the rate of respiration. With just a quick glance, it tells you what's happening. It's mandated for the use of deep sedation and general anesthesia, but it's not required for moderate sedation. However, I routinely use it in my practice for moderate or conscious sedation. It really gives me an extra degree of monitoring that I really come to appreciate. I personally would not work without it. We also have what we call a precordial stethoscope. It's actually attached to the patient's throat with connecting ear attachments, which I wear. With this, I can hear every breath sound the patient. They stop breathing. We can also connect the stethoscope to a Bluetooth device with a loudspeaker. When connected, this amplifies each breath sound so that everyone in the room can hear it. Some may consider this going overboard, but we've really come to appreciate these monitoring devices. We consider it well worth the investment. We also have a 3-lead EKG machine, which also has the capacity to measure the pulse rate. We also measure blood sugar levels before, during, and after treatment on our diabetic patients. I could talk at length about monitoring, but suffice it to say that proper monitoring is a requisite for sedation and for your safety. Following proper protocols, taking good medical histories and baselines with proper qualifications and the use of careful monitoring, sedation can be a great experience for all of those apprehensive patients. In fact, if it were not for sedation, there would be many dental cripples. There is now a way for virtually any frightened person to have their dental treatment in a relaxed and comfortable way. All you have to do is give us a call.